to date. It is a 44-bed mother home for women with high risk pregnancies. We don't need to be hospitalized, but we need to be close to the hospital. For example, twin pregnancies or placenta previa, or women with controlled high blood pressure, and moms with babies in the NICU. We also have 8-bed kangaroo care mother unit where we had cared for 362 babies. We have had 585 pregnant women admitted to Kaimamito and 977 mothers of babies in NICU. We occasionally have pregnant women who are victims of gender-based violence who stay with us until they deliver and they benefit from support from our psychologists. We occasionally have teenagers stay here who are vulnerable because of their age, and many are victims of gender-based violence. Thank you. And now back to Meredith to continue.
Okay, next slide, please. So this slide, these pictures are of our program Journey 9 or J9 or Accompagnement Neuf, A9. So these are photos of our groups and the different pillars of our program, which started in 2018. So I'll tell you a little bit about the 4 pillars. The first pillar is group antenatal care, which starts in the 2nd trimester of pregnancy and continues through delivery and includes 8 prenatal visits in group, which is the most recent recommendation from WHO, plus 1 postpartum visit in group. These groups of 10 pregnant women have the same gestational age, and they have 2-hour appointments with education, normal prenatal visit, and they benefit from the group support atmosphere. The second pillar is the group pediatric visit, which you can see in the top left-hand corner. The group pediatric visits start around 1 to 2 weeks of life, and they continue through the baby's first year of life. These visits are also 2 hours, and the groups of 10 mother-baby pairs, the babies are all the same age. They benefit from the group support atmosphere with education, teaching, well baby checks, and we have a pediatrician on staff for sick babies. The third pillar is the community-based care or home visits, which you can see in the photos of us walking to visit a woman in her home, and another of Ms. Bruni, our family planning nurse, offering family planning to a woman in her home in the upper right-hand corner. So women really feel important and valued and validated when we come to visit them in their homes. They have impressed us with how happy they are that we pay them a visit, and during the visits we check water and sanitation, and we do a home prenatal or postpartum visit or a well baby check. We also offer family planning as needed, and we remind women about educational subjects that we've talked about in the groups and the warning signs for pregnant women and for babies and postpartum women as well. The fourth pillar is psychosocial support and counseling. This is really one of the key support pillars for our program. Every woman is screened twice in pregnancy and postnatally for PTSD and depression. We offer support to women who screen positive and also do things like stress reduction for all of the prenatal and postpartum and pediatric visits. Our psychologists and social workers also support women in Kaimamito, and they reach partners during the home visits and are able to do couples counseling when the partner doesn't come into the hospital for appointments. Women tell us how much the groups really mean to them. One woman told us that she was with the same group of women from the time they were pregnant through their children's first year of life. They really bonded with one another, and she said that she loves the other women in her group. So far, we've had over 2,000 pregnant women pass through A9 to date since 2018. And we did a small study last year and found that women who participated in A9 were less likely to have severe preeclampsia or eclampsia compared to the control cohort. We also found that the babies are more likely to have a normal weight at birth compared to a lower birth weight among the control group. Next slide, please. So these last photos are of our adolescent extension of A9. Adolescents make up 11% of our deliveries at HUM. With our adolescent groups, we're extending the accompaniment model to form a group of adolescent support in addition to their regular group prenatal care. We're also forming adolescent clubs. In our adolescent club program, we're forming 15 adolescent clubs with 20 teenagers per club in this first year. So we're targeting 300 adolescents in the first year. And we're addressing such subjects as sexual reproductive health education, family planning, mental health, with a focus on gender-based violence reduction. The goal is to reduce and avoid unintended pregnancies. And we also hope to introduce and provide visions of hope for the future for our adolescents through STEAM professions in the series on professional presentations. STEAM stands for science, technology, engineering, the arts, and mathematics. We recently started A9 Plus in Ench, which is another site supported by Zami La Santé, in last month, September 2021. And we so far have 11 groups to date. And one of our hopes is to build 2 larger rooms in Ench that can accommodate the prenatal and pediatric groups there. We wanted to share, I'm not sure if the video will work, but we wanted to share this short video with you. It's a short clip of Amos, who is giving a guided meditation to a group of teens who participated in the summer camp. I'm not sure if it will work. So it was a very short clip. But you can see Amos at the far end of the room, and he's teaching the adolescents stress reduction. So this is just one example of the innovative ways that we're impacting our young people's lives. So thank you for listening to our short presentation on our maternal and child health program here in Mibale, and we look forward to hearing your questions. I'll pass it back to you, Krista.
Great. Thank you so much, Tamar, Josette, and Meredith, for that really informative presentation. If you have questions, please place them in the chat and we will ask our panelists. But I will get us started with a couple of questions. I've heard you mention gender-based violence a few different times, both you, Meredith, as well as you, Tamar. And I wonder if you could talk a little bit more about why that's such an important aspect to address in maternal and child health.
Mm-hmm. Okay, I'll go ahead and start. So gender-based violence, there's a link between gender-based violence and preterm labor, preterm delivery. And so in the groups, we really do a lot of screening and teaching around the importance of respect between in the couples counseling. And we really try to offer a lot of support and extra support that the psychologist provides to the participants in the groups if they screen positive for gender-based violence. Tamar, did you want to add on to that?
It looks like maybe Tamar is having some technical issues. The other question that I had is, for traditional birth attendants or matrones, and the statistic that Tamar mentioned about the majority, or 37%, nearly 40% of women still give birth at home, how do you sort of bridge the gap between traditional birth attendants and women who may still prefer to give birth at home and facility-based care? Can you guys hear me okay?
Okay, we can hear you, yes. So we have a relationship with the matrones, and we have a close relationship. We do trainings for the matrones, and we teach them about warning signs in labor, in pregnancy, and postpartum. And so anytime that the matrones or the traditional birth attendants come across these warning signs, we have a close relationship with them, so they refer directly to the hospital. We're also starting another phase of our relationship with them to really try to track better the referrals that we do receive from the matrons. Another aspect that we're going to try to hopefully be able to branch into the future is giving them training on how to provide labor support, similar to doula support. So they do that quite well already, and women really appreciate the massage and the home therapies that the matrons offer. So we really want to be able to offer that as well in the hospital to women coming to the hospital to deliver. So we continue that collaboration and bridging that gap to make sure that the community to hospital relationship is strong and strengthened.
That's great. We have a question here. Have we had any mothers who've received care through HUM come back to become a provider or CNM? Has there been an opportunity to get people from Haiti interested in staying and becoming caregivers?
We have a woman who participated in one of the groups who is a nurse. She just got her nursing license. So she doesn't have her nursing license in hand, but she just passed the exam, the national exam. And she's very motivated and interested in continuing the program, continuing to participate in the program and support other women in her new role as a nurse. So I haven't heard of nurse midwives or women who are trained as nurse midwives who are joining who have been in the program, who are now working for us, but I imagine that will be coming. Tamar, did you want to add on to that? Have you heard of other women who participated in A9 who are nurses?
I only have the one you talk about. I don't have. We had another one. She was a midwife, but she don't want to stay because she must leave Haiti to join her husband in the United States. But she didn't stay for a long time with us. But it was a great opportunity to us to have a nurse midwife in our 39th group because she used her skill to train other women in the groups also. She was really helpful and kindness.
That's great. And I know through the... Sure, go ahead, Josette.
Yeah, we actually have a mother in Camomito. She was a victim of the earthquake. She's a nurse, but now she doesn't pass the exam yet, but she is very interesting to work in the hospital. Unfortunately, she lives in Jeremy, Ganas, okay? But she's studying anything else now, but she's very interesting to come back. But I told her that we are waiting for her until she passed the exam. We will be so proud to have her with us.
That's great. And I know the medical residency...
It will be an honor to us to have a patient nurse in.
Yes, it will be.
Have this opportunity. Yeah.
That's great. And I know that the medical education and training programs like the OBGYN program, a lot of those residents or doctors who go through that program end up staying in Haiti and providing care across the country. Maybe you can talk a little bit more about the OBGYN residency program.
Okay, the OBGYN residency program is 4 years. We are now in our sixth cohort. So there's already been 3 groups. So 12 residents have already graduated from our OBGYN residency program here. It's 4-year program similar to the US, and they all rotate through A9. They all to participate in home visits, and they see the benefits of group prenatal care, and they really, they're really one of our strongest supporters in this new program. So we're thrilled that the new cohort of residents who are trained in our hospital are also, you know, very interested and very dedicated to the population that they're serving, and they see where women live and where they're coming from, and the efforts, the efforts that women make to get to the hospital. Sometimes it's 5-6 hours by foot before they get to a main road. Women really travel long distances in this area, over mountains. As the book Mountains Beyond Mountains, it's very true. Tamara and I spend a lot of time on foot getting to women's houses with the team.
And the good news is we have the OBGYN we have at 39 at Inch is the last graduate of cohort of OBGYN we have at Mirabel.
Oh, yeah.
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 Dr. Tyson.
That's fantastic. We have another question here. What are some common questions that new mothers ask during their time at Kai Mamito?
Did you want to?
Oh, yes. First time coming to Kai Mamito, they ask where I'm going to live. Am I living here? Can my family come and see me? Can my family come to visit me? Can I have quick access to healthcare at Kai Mamito? It is the questions that they ask before coming at Kai Mamito. When we receive them at Kai Mamito.
And then after they've delivered, are there common questions that they have, or when they have questions about anything related to their postpartum care, do you find that there are typical questions that people ask?
Yes, sometimes they ask if they can stay with us.
Because the care is so good. They're getting such
Yes.
good care.
Sometimes they want me, some leaders, to say, oh, Miss Tama, I need to stay. Can you do something for me? Because here I feel comfortable.
Yes.
They really enjoy the professional trainings that we offer them. So
Yes.
it's really an important aspect of the package of care that we provide at Kai Mamito.
Yes, I've been to Kai Mamito and I wanted to stay myself. So I can certainly understand why the women want to stay there. And actually, when I did visit Kai Mamito, there were, in a separate room, there were a couple of men who were there. Either they were visiting or staying, but maybe you can talk a little bit about the role that fathers play here, either in giving kangaroo care or just in overall maternal and child health.
Yeah.
Can you explain
For
the papas, their role?
Yeah. Unfortunately, at Kai Mamito, we only receive the mothers and the babies. But sometimes a father can stay at Kai Mamito to help her wife with the baby. We don't receive them. We have only mothers and babies. In kangaroo care too. Maybe sometimes father can say I can go care to help, because sometimes the mothers can be at postpartum and the babies need to be at kangaroo care. Now the father can stay with the baby.
And just in case people don't know what kangaroo care is, maybe you can talk about it.
Yeah. And usually we have not only father, we have grandmother, sisters can come and to do kangaroo care with and to help the mothers at Kai Mamito. And we have sometime we get access to visit. It's about 2 hours, Josette, per day.
2 hours in the morning and 2 hours in the afternoon.
Yes, per day to baby member of family can come to see the woman.
Yes.
And what is Kangaroo Care?
Kangaroo Mother Care is a skin-to-skin model of care for preemies who are what we call growers and feeders. So they don't need to be on oxygen, they don't need IV antibiotics, they don't need other interventions. They really just need to breastfeed and be skin-to-skin with their mother 24/7. So sometimes, as Tamar and Josette were explaining, sometimes the father will take that role for a little while to give the new mom a little break. Sometimes the mother, the grandmother, the auntie will take turns helping out because it's quite intense. The mom has to be in bed or skin to skin with her baby 24/7 and breastfeeding, and those babies really, really do well. Tamar and Josette, you can tell a little bit more about the results that we've had with the Kangaroo Mother Care.
The big result, we have 0 death at Kangaroo Care. And the babies is grow up because Kangaroo Care help babies keep the temperature and the weight also. It's really beneficial, and we can increase family planning and breastfeeding.
That's great.
And it is a very, 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 very interesting when you are at Kaimaminto and you see someone come with a child who was at Kangaroo Care, like a little baby.
Mm-hmm.
Now, the mother come to see you and tell you, here is my baby. And you say, oh, now it is very, 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 it is a joy when you see them coming back to see you.
We have another question. What kind of support is given to adolescent participants after completing the STEAM program?
That's a very good question. So we have just started our Journey 9 or Accompaniment program with the adolescents. So we envision that we'll be able to, in the future, have a relationship, sort of a peer educator type of relationship with the adolescents who participate in the program, to start now teaching and providing support to the next group of adolescents. We haven't gotten to that point yet because we're just in this first year of the program, but we're really excited to see where it leads and how we can develop the next leaders in the communities and right in the communities around Mirebalais.
Since the ladies do not make the decision to get prenatal care, what kind of problems result and what is the level of resistance?
We've had some traditional birth attendants who have explained to us that despite their recommendation to refer women to the hospital, some families do not want to go to the hospital, or they don't want to refer to the hospital, or they wait until the very last minute, and we receive women in very critical states. Sometimes postpartum hemorrhage, sometimes we receive women who have had all of the signs of severe preeclampsia, and then the family makes the decision when the woman starts having seizures. So it really can be detrimental to the morbidity and mortality of pregnant women and postpartum women when the traditional birth attendant and the women themselves are not the primary decision makers. So it can have detrimental effects on them.
Is there anything that we do in our programs to try to do some training or education around that to help the families make better decisions?
Mm-hmm. Well, I think that maybe Tamar can also talk about this, but the Journey 9, the accompaniment NERF, this new program with all of the pregnant women the same gestational age, acting as a support group for one another, and the nurses doing a lot of teaching and reinforcing education, warning signs, when to come to the hospital. We've really been able to have women come early and avoid all of those consequences. So I feel like the prenatal education and reinforcing those warning signs. Tamar, maybe you can explain a little bit more from what you've seen also in the Journey 9 program.
Yeah, during the meeting with the women, the nurses take place and explain, maybe we have some specific subject according the appropriate subject for the woman. Sometimes we talk about family planning, the warning sign, and sometimes we include in the partners also, because sometimes they come with a partner, and we do brainstorming after the education session. We ask, we do we play some video, we did some little play, like we can use some cards and to talk about the warning sign, breastfeeding, and the family planning, vaccination, etc. And during after the education session, the physician or midwife or one nurse accompanier continue to do the physical exam. And sometimes if the woman have some warning sign, we do the referral at the emergency for the woman at the hospital. I don't know, Meredith, if you want to add something else.
I think that you completely answered that question. It's very empowering for women to receive all the education that we provide to them in pregnancy. So I think that's contributes to our outcomes.
In thinking about prenatal care, what other kinds of outreach does Zami La Santé do in early pregnancy to try to catch any potential complications, to monitor women in the early stages of their pregnancy?
So we have a strong relationship with our community health workers, and we really try to reinforce the importance of seeking prenatal care early, and getting tested early in pregnancy and coming in for screening and treatment. And that's also the time that women will be able to join the Journey 9 program as well. So our communication and our relationship with the community health workers has really strengthened our women's adherence to prenatal care, but also attendance early in pregnancy.
And kind of along the same lines, just as a little bit of context, during the Great Depression, Alpha Kappa Alpha sorority implemented a public health initiative called the Mississippi Health Project. And the purpose of that project was to bring healthcare to Black residents in rural Mississippi Delta communities. They often had to walk miles to receive, unfortunately, substandard healthcare. Over the course of that project, volunteers set up mobile clinics providing vaccines, malaria treatment, and workshops to combat malnutrition. To me, this sounds very similar to what PIH does. And I'm wondering if you could talk a bit more about the importance of community-based care outside of fixed health facilities in combating maternal mortality. You talked a little bit about community health workers, but how important is it to do the mobile clinics, the home visits, to reduce maternal mortality?
I think the home visit is a very important thing, because women are living at home with their partners who doesn't respect them. When we go home, when you go when we go home to see them, we have the opportunity to see the family, the partner, and the mother together. We can talk to them and make sensibilization, talk to the partner. But home visit is a very important thing for us. And we have we have very close to the community that help us helping the mothers. They are, when they, for example, when they come to Kaimamito, they used to talk to us about how they live at home. Some of them don't want to talk about what they are living, how they live at home. But some of them talk about how the partner treat them at home. And then when we go home to see them together, it is a very, very important thing. We help us.
And as Josette said, it's a great opportunity to us to see the economical and social situation of the patient. And we talk about, we reinforce also education about hygiene and the psychosocial support with the family. We talk about taboos, because sometimes in Haiti, grandmothers say, oh, you need to give tea, you need to, you can't eat this like akra, like some legumes, some fruit, okay? And sometimes we talk about taboos, and we see also the distance of the woman live to go to the hospital, or that give us some empathic affection, yeah. And we keep the relationship with the social worker, because we use them like accompanier also in the home visit, when we do home visit.
We also have a big challenge. It is sometimes a woman come back to the hospital with a pregnancy, with an early pregnancy after delivery. It's because the partner doesn't respect the time before delivery. It is not always because the mother wants another baby. It's just because the partner doesn't respect the time before delivery. It is a big challenge. I think we could also do a focus group with the partner to talk to them about this subject.
And how does something like that affect family planning as well, when you start to talk to women about the spacing and timing of birth?
Some of them doesn't want to take a family planning. We need to talk with them, but sometimes they don't take it before leaving.
Mm-hmm.
Sometimes they shine also, Josette. They shine and they scout the partners, the family, yes, and the friends. They really shine about family planning. I don't know why.
Mm-hmm. Yeah. There's another question here about if we are based in one area or region, or do we have satellites or extensions throughout the country. And we talked a little bit about geography earlier, but we've mainly been talking about University Hospital in Mirebalais and a little bit about Inch, but maybe you can kind of just, maybe for people who haven't been to Haiti, just give us a general sense of the geography.
Okay. Zemi La Santé is in the Central Plateau Department and in the Artibonite Department, and we support 11 hospitals and health centers in these two departments. We have been doing outreach in the South since the earthquake. Tamar, can you talk a little bit about what our work is in the South?
You're on the best way. Go ahead, Meredith.
So we're supporting, I think is it Kai Hospital? I think we're supporting Kai Hospital. That's in Kai in the south, very close to the epicenter of the earthquake. And we are supporting
And Saint
the
Boniface
hospital with
also.
materials and physicians. I'm sorry?
Saint Boniface also. And
That's right, and Saint Boniface Hospital, exactly. They were doing a lot of surgical interventions post-earthquake out of Saint Boniface Hospital, which we are in a close collaboration with.
Mhm. And a lot of that work is continuing today. The earthquake happened on August 14th, and we continue to provide support to the South through mobile clinics, equipment, medical supplies, medications, and of course, always with women and children in mind, and making sure that they have access to the care that they need. We are coming to a close here, but I just want to ask one final question, because Alpha Kappa Alpha is a group for women, and we have 3 women here. So as women, as healthcare leaders, how is it for you, particularly Tamar and Josette, to be in your country, helping women and knowing that you're having an impact, a positive impact on their lives?
According to me, I think helping women to save in life, it's a great opportunity. Economically, women, as you know, in Haiti, as I said you on the first slide, they really contribute in the family, and about sometimes they do commerce, like Madame Sarah, they take tap in the bad condition to go to the downtown to the commerce and to take money to take care of children. And like we say in Haiti, femme c'est potomitan. We have strong, and when we save the life of women, I see me in her first. I see my mother, I see my sister, and I think it's a great opportunity to me to saving life of babies and women, because woman is a pillar. Woman, c'est potomitan, like we say in Creole. And it's really, I'm really proud about the MCH program, because what we did every day contribute to saving women lives.
And Josette, how about you?
For me, University Hospital of Mirebalais is my second home. It's always a pleasure for me to work with the mothers, and with my patients.
Excuse me, Josette is the mother of all of you. All of us, excuse me.
Thank you,
The
Dama.
mother of the patient, mother of us, mother, everything we need, we can ask Josette.
I'm not working at night, but sometimes I'm working at night for helping the mothers. If I leave the hospital and I see a mother pregnant will come to deliver, it is very difficult at the hospital, because we are patients from all departments in Haiti come to the hospital. And I don't know, I don't want to pass a day in the hospital without talking to someone. I don't know. It is my passion.
Yes.
Okay, I like the field. I like working on the field.
Yeah.
Okay, I like working on the field. I like talking to others. This is my, I don't know. I love it. Okay, it is when I'm working. I don't know what time is it. I don't know. I'm working.
Yeah.
I'm working. I love my patient. I'm working. I don't know. This is my life.
And the other thing like that make me proud also, when I see a woman in the street, they said, "Oh, look at Mr. Ma. She was helping me when I was at the hospital. She was helping my babies." I'm really proud about that. I'm really proud about that. And as Josette said, it's my feeling to to help women, and I really love my job.
Yeah.
That is
It's
great.
a pleasure when you go somewhere and see someone say, oh, madam, this is, oh, I don't know, this is, oh, yes.
When I first lived in Haiti, some of the first phrases that I learned were potomitan,
Mhm.
femme jam,
From
and
people.
femme vaillant.
Yes.
All have something to do with the strength of a woman. And I think that just goes to show you how important women are to Haitian society and why it's so important that we do whatever we can to save their lives and the lives of their babies as well. Well, thank you, Tamar, Josette, Meredith, and thank you all of you for joining us. I'll turn it over now to the president of the Gamma Zeta Omega chapter of Alpha Kappa Alpha Sorority Incorporated, LaShondra Willis. Madam President.
Thank you so much. Good evening. On behalf of the members of Gamma Zeta Omega chapter, I thank each of you for joining us this evening for part 1 of our Global Health Series, Ensuring Healthy Babies and Safe Deliveries in Haiti. Too often we go about life disconnected from the challenges faced by those outside of our sphere, at times taking our blessings and access to healthcare for granted. I hope the information shared this evening was enlightening and inspires you to assist organizations such as Partners in Health continue their service to those in need. Thank you to our partners for tonight's event, Partners in Health, our presenters, Tamar Jumeste, Josette Jean Louise, and Meredith Jean Baptiste. Thank you for sharing your experiences with us and giving us a snapshot of what mothers and babies are facing in Haiti, and how your impactful service is saving lives and providing care to those in need. Your work is truly inspiring. To our moderator and member of Gamma Zeta Omega chapter, Krista Mashad, thank you for connecting us with your organization for such a worthy cause. Thank you to Target 5 Global Impacts, the committee members under the leadership of Andrea Minchin-Johnson, chairman, and Erica Thomas, co-chairman, for bringing this initiative to our platform this evening. I encourage each of you to visit our webpage at akagzo.org for more information on our upcoming events and subscribe to our YouTube channel, aka Gamma Zeta Omega chapter. Stay tuned for part 2 of our Global Health Series coming soon. Thank you all again and have a good evening.